My question is, I'm a little confused whether you are relying on an intrinsic worth of life that just is prioritized over everything, or whether it's the fact that you believe you can relieve all pain. Hypothetically, if someone were in excruciating pain, that just unbearable, no matter what you did in terms of palliative care, would you still be against physician-assisted suicide?
Excellent question.
Yes. Again, first of all, I'm not a vitalist. I don't think that life itself is the value here. Secondly, that I've suggested several times here that the person who is in the kind of excruciating pain you're talking about, under my care or Dr. Finlay's care, would be able to get increasing doses of morphine until the point that their pain was relieved, whether that hastened their death or not. My aim there is not to eliminate the patient, but to eliminate the patient's pain, and I foresee the possibility that this could happen, but that's not my aim. What I want to do is reverence people, right, and not act with the specific intention of making them dead, of turning somebody into a nobody. I want to eliminate pain where I can, and if it takes making them unconscious in order to do that, I'm willing to do it.
Ma'am, did you... let's get the mic back to you, because I just want to make sure. It was a really good question. I want to make sure.
I'm sorry. I don't think you've answered my question.
Take 10 more seconds and get right at it.
Hypothetically, you cannot alleviate the pain. No. I'm trying to understand your underlying argument, because this feels utilitarian.
Okay, don't argue with him, please. Just
I'm
make
sorry.
Make it a question.
I would ask you to accept the hypothetical, but I can only ask.
Yeah.
Well, I think your partner wants to take a crack at it also.
Can I answer?
Finlay.
Because you've asked a practical question. I've seen patients whose pain score was 11 out of 10, not just 10 out of 10. I have sat there with a syringe full of diamorphine and injected slowly, milligram by milligram, minute by minute, until their pain score is down and it is bearable, until we get it under control, and redoubled efforts. And sometimes the person has been a bit sleepy for a time, and we've had side effects and we've had to get over them. But my role as a doctor is to relieve that suffering. Those patients may say, I can't bear this, I ought to be dead. But that does not continue, that request does not continue when you get on top of their symptoms. I've had conversations with hundreds of patients about how they feel, about what's happening to them. Many people are devastated when they first realise that they have a life-threatening illness. The world is not as they thought it was going to be. But actually, when you work with them, and it is hard work, they come through and they often have a fulfillment that they never imagined they could have before. I've had people who've wanted, theoretically, to have assisted suicide or euthanasia, but they've abandoned that when they themselves are ill.
Okay, but that's not the question. You've both evaded the question. The question asked you to accept the hypothesis that you can't relieve the excruciating pain. It's an attempt to understand your underlying philosophical or ethical position, and neither of you've both just evaded that question.
But no, because I don't accept... No, there's a fundamental premise here and a misunderstanding. Those of us that actually are the ones with the drugs and the techniques to relieve the pain keep on trying and going back and back and back again. So you're painting a hypothetical question.
Yes,
I'm saying I faced it practically, and I still oppose physician-assisted suicide.